Testosterone is the primal essence of manhood. Testosterone is the gift, gives men the strength, the drive, and the resolve to achieve goals. It's part of what makes man a man. But what happens when testosterone levels drop? Does that affect the heart's health? What happens if we correct testosterone deficiency with exogenous testosterone? Would it damage the heart or heal it? What does the latest research on testosterone replacement tell us?
Welcome to Cardio Buzz, your one-stop shop for all things cardiology. We're here to bring you the latest news and information about heart health. Whether you're a healthcare professional or just someone who wants to learn more about heart health, we have something for you.
Testosterone is a male sex hormone that is produced by the testicles. It's not only responsible for male sexual development, sexual desire, and sexual performance, but it's also important for bone health, muscle mass, mood, and energy levels. Testosterone levels peak between the age of 20 and 30, then they decline 1% to 2% annually throughout life. But 10 to 40% of men have testosterone deficiency, known as hypogonadism, and that can be caused by obesity, smoking, or other specific medical conditions. When testosterone levels are low, it can cause low sexual drive, erectile dysfunction, fatigue, muscle weakness, depression, hot flashes, and reduced bone density. Also, some observational studies have found an inverse relation between endogenous testosterone levels and mortality, particularly in older men. Lower levels of testosterone were associated with increased risk of coronary disease, heart failure, and stroke. And for those with low testosterone and symptoms of testosterone deficiency, replacement therapy can be used to relieve the symptoms. Probably the most common indication for testosterone replacement is erectile dysfunction, and that's a condition which roughly affects 50% of men between the age of 40 and 70 years. Testosterone replacement can also be used to treat anemia caused by chronic kidney disease and osteoporosis. And because of all of these indications, testosterone replacement therapy is widely spreading. In the United States, testosterone prescriptions have increased fourfold between 2003 and 2013. The global market for testosterone replacement is expected to reach more than $2 billion by the year 2027. So testosterone replacement does help to relieve the symptoms of hypogonadism and erectile dysfunction. But is it safe for the heart? Well, previous studies on men taking testosterone replacement have shown mixed results, some indicating increased risk of cardiovascular events, while others suggesting decreased risk of cardiovascular events. That's why the FDA in March 2015 issued guidance that requires manufacturers of testosterone products to conduct clinical trials and find out if their testosterone replacement therapies are linked to a high risk of cardiovascular events or not. And we have the results of the biggest study on testosterone replacement released last month. A group of researchers led by Cleveland Clinic published the results of the TRAVERSE study in the New England Journal of Medicine in June of this year. They studied 5,246 men between the age of 45 and 80. They all had elevated cardiovascular risk, and half of the patients had pre-existing cardiovascular diseases. Half of the patients were 65 years of age or older. All the studied men had symptoms including erectile dysfunction, decreased sexual desire, decreased energy, or hot flashes. And they all had reduced levels of serum testosterone tested twice. They excluded patients with history of prostate cancer, elevated PSA, uncontrolled heart failure, recent acute coronary syndrome, or recent coronary revascularization. Patients were randomly assigned to receive daily transdermal testosterone gel or a matching placebo. They were treated for an average of 21 months, followed up for an average of 33 months. The researchers looked into the first occurrence of death from cardiovascular diseases, myocardial infarction, stroke. They also looked at coronary revascularization, hospitalization, urgent visit for heart failure, peripheral arterial disease revascularization, and even venous thromboembolic events. Along the study time, serum testosterone levels, of course, were higher in the group that received the replacement, not the placebo. Testosterone or placebo were discontinued in patients with testosterone levels that exceeded 750 nanograms or when the hematocrit exceeded 54%. Also, testosterone or placebo were stopped in patients who had a newly diagnosed prostate cancer during the trial or those who were high risk for suicide, because testosterone increases the risk of prostate cancer and also the risk of suicide. The main findings of the trial that there was no increase in cardiovascular events with testosterone replacement compared to placebo. There was even a tendency for less cardiovascular death with testosterone replacement that was not statistically significant. The study generally reassures patients who need testosterone replacement therapy that it's safe. But several points need to be mentioned. The incidence of pulmonary embolism was higher with testosterone than with placebo. Therefore, testosterone should be used with caution in men who have a previous thromboembolic event. Also, in the testosterone group, atrial fibrillation, acute kidney injury, and arrhythmia occurred more frequently. The study was not big enough to test these side effects, so we cannot derive solid conclusions, but they call for a discussion between the treating physician and the patient. So, after excluding prostate cancer, recent heart failure, acute coronary syndrome, testosterone replacement did not cause more cardiac death, MI, or stroke compared to placebo. So, we can consider it safe. But please discuss with your treating doctor about your condition if testosterone fits you or not.
Thank you for watching. We hope you enjoyed this episode of Cardio Buzz. If you did, please give us a thumbs up and subscribe to our channel. And don't forget to check out our other episodes for more information on cardiovascular health. See you in the next episode.